This recent preprint from Ward and colleagues at the University of Cambridge and the Cambridgeshire and Peterborough NHS Trust asks a question we've understudied. When an autistic person experiences a first episode of psychosis, what actually happens to them in our mental health system? The starting point is a known but uncomfortable overlap. Autistic people carry a 3 to 4-fold higher risk of developing psychosis, and we already know they tend to have poorer health outcomes, worse experiences of healthcare, and reduced life expectancy. England delivers early care through early intervention in psychosis services, but the open question is whether those services serve autistic patients equally well. Prior evidence hinted at poorer outcomes. This study set out to characterize them properly. This is a retrospective cohort study drawing on de-identified clinical records from one NHS trust from 2013 onward. They identified everyone with a psychotic disorder diagnosis, just over 7,400 people, and compared two groups, 224 autistic people, including those still on a diagnostic waiting list, against 7,185 non-autistic people. They modeled community service use, hospital admission, length of stay, and medication, using Cox regression, logistic and negative binomial models, adjusting for age, gender, ethnicity, and deprivation, and crucially for learning disability. So what did they find? 3 things stand out. First, community services. Autistic people were significantly more likely to be detained by police under Section 136 and made more frequent calls to crisis phone lines, but, interestingly, were less likely to be referred to a crisis home treatment team. That's a pattern of crisis-driven, emergency-heavy contact. Second, hospitalization. Autistic people were about 40% more likely to be admitted, an adjusted hazard ratio of 1.42, and when admitted, they stayed far longer, a median of 112 days versus 49, more than double. Third, and this is the elegant part, medication prescribing was essentially identical between the groups. So the difference isn't in the drugs, it's in the system around the patient. The most important analytic nuance is learning disability. Once you separate it out, much of the autism effect on community service use weakens, while learning disability remains a strong independent predictor of both community and inpatient use. The authors argue the effects of autism and learning disability aren't simply additive, so we can't treat autism plus psychosis as one homogeneous group. The co-occurring profile genuinely matters. The interpretation they offer is unmet need, heavier reliance on police and emergency lines, longer stays, more out-of-area placements. These echo the post-Winterbourne view story of shrinking institutional care without matching community capacity. Now, caveats. This is a single trust, a small autistic sample, significant data missingness, especially ethnicity, and it's a preprint, not yet peer-reviewed. Causation isn't established, but the take-home is clear and actionable. Autistic people with psychosis use services differently and more intensively, particularly at the emergency end. The call is to invest in community care with admission avoidance at its core, and to replicate this in larger data sets.